So the humanitarian country team of Mozambique is responding to large floods caused by the river Licungu in the Zambézia province of Mozambique.
The provision of health interventions is already a challenge.
And now with the emergency, you can imagine how challenging the situation is.
We have to coordinate all the actors together, which is a bit difficult at this particular time, and the rain keeps coming. This is a vast country, most of it underwater. Roads are no longer accessible, we need helicopters.
We actually focus on 4 main areas for the time being for the response, which is shelter. We want at least 50,000 people covered with shelter items. We are also working on water, sanitation and hygiene.
We are providing and making sure, providing water supply facility, bucket, certain of water treatment, and also making sure that every household do have a sanitation facility so we can reduce the impact of the emergency.
We are also working on food security. The idea is for the next 30 days and plus months to cover for 100,000 people affected by the floods in terms of food.
Without the help of the United Nations, the situation would be much harsher.
As the UN, we have been able to use the contingency plan stocks that we have put together with our partners, but that is not going to last more than 20 days, 1 month. Of course, what we are providing to people now is coming from our own reserve stocks, and we need to replenish, we need to continue supporting them for at least 1 month, and then when they go back to their area, it is important that we are there to support them resettle.
The fourth element that we're really focusing on is logistics. Logistics has been a huge challenge here in Zambézia. The force of the water actually destroyed a large number of roads and sections and bridges. So even taking our humanitarian assistance to the places where it's most needed, it's actually challenging and difficult.
Because of the environment, many times, these kids can be abused. So also we are providing information on how to address, how to prevent abuse, how to cater for the safety of the youth. We are also trying to address the needs of communication, of information. ICS is providing messages on their loudspeakers about malaria, water and sanitation, cholera, the safety, and many other information related to the emergencies.
So we're calling to donors, we're calling to partners, civil society, private sector to continue supporting this effort. We do need more stocks in terms of shelter, in terms of food, in terms of water and sanitation items, and we will focus very much on supporting the logistics, both through the airlift and through ground transportation.